Hello, my name is Allison Sanza with KLRU TV. We recently reached out to our viewers to ask how you would like us to cover the tragedy in Newtown, Connecticut. Most of you said you would like us to focus on access to mental health care in our community. That's why joining us now is Adrienne Kennedy. Adrienne is president of the Austin chapter of NAMI, the National Alliance on Mental Illness. Thanks for being here.
Thank you. Thank you for having me.
Could you tell us a little bit about what NAMI does here locally and about your mission?
Our mission, first of all, in NAMI and NAMI affiliates across the country, is to actually bring education, information, good support, and advocacy so that people in communities can get the help they need by face-to-face contact with others, those of us who've had the experience of severe and persistent mental illness in our lives, either in the lives of close family members or in our very own lives, so that we can share from a point of lived experience those things that we need to know to navigate the mental health system, as well as to navigate the realities of life.
Some of those realities of life, you said, start when people are very young. And you recently met with the Texas Education Agency. What did you tell them, and how do you work with schools in our area?
Well, first of all, again, it's carrying the information, because what we know is that 50% of all diagnoses would be accessible to us. We can see in the health care of children 14 years or younger. So there is a tremendous onset of the beginnings of mental illness or where mental health needs are showing up in an early population. So consequently, we want to really inform people about how they can be alert observers to see how a child's behavior is happening and what's happening in the developmental nature of that child. And childhood is the most observed period of our developmental human history. And so if we can join parents and teachers together, parents and counselors, parents and nurses together to have these conversations in really productive ways, we can help them get the information they need to bring children the help they need early on. Because of the children who have a diagnosis even early on, and 1 in 10 children do have an early diagnosis, only half of those ever get served and ever have early intervention. And intervention is the way that we preserve the integrity of the brain to grow through developmental stages that are appropriate.
In 2009, NAMI National gave the Texas mental health system a D on its report card. How would we score now, and why are we getting such poor marks?
I think it's still about a D. That doesn't mean that there aren't some A-pluses out there. They're incredibly dedicated people working this field with great vigor and great clarity of purpose and mission. But the point is that the way that NAMI does the scoring is based on the per capita spending in mental health care. And in fact, Texas ranks 49th in the country. The only state lower in its per capita spending is Idaho currently. So that's how we rate the D, and have been for some years in the lowest 2 or 3 across the country.
How would we improve those grades?
We'd improve those grades, first of all, by actually funding better in terms of our per capita funding. Because what we know is 1 in 5 families will experience severe and persistent mental illness in the lifetime of a family member. So we want people to be well educated about it, so they will feel not the shame and the blame and the stigma that so often keeps people from accessing treatment, but so they can really get to a mental health care provider, a medical doctor, and someone who can take good care of helping them figure out the situation.
What would you tell parents or family members how they can get involved with what you do?
Well, the easiest thing is just to give us a call. We're on the web. Our web address is www.namiaustin.org. Our telephone number is 420-9810. We take people signing up for our classes, which are offered free in the community. Throughout the community, we have sites all across Austin. And in fact, Central Texas, we offer classes as far north as Georgetown and as far south as San Marcos and out to Bastrop and whatnot. So we want to place classes where they're convenient for parents and caregivers to have access to the information, and then also for people who have a mental health condition that they want to know more about. They can join our classes as well. There are classes especially for people who have their individual experiences taught by people who also have a mental illness that they're dealing with effectively.
Okay, well, thank you so much for being with us today.
Thank you.